Hello friends, in this video we would be discussing about the various do's and don'ts that need to be followed post extraction of a tooth. So this video would be helpful for the patients who are going to get their teeth extracted as well as for the dental students and professionals. So let's begin. The first and the most important thing post an extraction is not to remove the pressure pack given by the dentist before the completion of 1 hour after the extraction. The purpose of this pressure pack is to control the bleeding from the extraction site, and it is during this period that the clot formation will take place. After 1 hour, the pressure pack can be thrown away. After 1 hour, the patient should eat a plain ice cream, that is, an ice cream without any solids like fruits, nuts, or cookie bits in it. Diabetic patients can take chilled water instead of an ice cream. The purpose of eating an ice cream after an extraction is that cold foods like ice cream will constrict the blood vessels and it will reduce bleeding, and it will also prevent the occurrence of swelling in that region. Now, the third instruction is that the patients should without fail take their medicines, painkillers, and antibiotics as prescribed by the dentist for the required duration. Then, the fourth instruction is that all the saliva that is produced in the mouth, as well as any blood if coming from the extraction site, should all be swallowed, and nothing should be spit for the next 24 hours after extraction. The reason behind this is that spitting can dislodge the clot, which will further complicate the healing process. Similar to spitting, gargling can also dislodge the blood clot, and hence it should be avoided for the next 2 days after extraction. Another important thing is that whatever the patient is drinking, be it either water or juice, it should be drank directly through the glass. Straws should not be used for the next 2 days after extraction. The reason being the same, that the use of straws create a negative pressure within the mouth which can dislodge the clot. Now coming to the seventh and a very important instruction, that is not to brush directly at the extraction site for the next 3 to 7 days. The other regions of the mouth can be cleaned with a toothbrush, but care has to be taken while brushing not to disturb the extraction site with a toothbrush or finger. This would otherwise complicate the healing process. Now coming to the point, what can be eaten and what not after an extraction. So, all sorts of hot, hard, spicy and sticky foods should be avoided for the next 3 to 7 days after extraction. The patient should have a soft diet which is at a normal temperature for the next 3 to 7 days after extraction, and he should also drink lots of fluids during this period as it would promote healing. The application of ice pack on the side of the face on which extraction is done can also help to prevent the occurrence of swelling. It should be applied during the first 24 hours after extraction. The pack can be applied in a 15-minute on and off method for 1 to 2 hours. The pack should not be applied beyond 24 hours. Hot pack should never be applied for dental pain. The patient should avoid sleeping directly on the side of the extraction. The head has to be elevated while sleeping by use of an extra pillow. Next, coming to the 12th point, which says that all sorts of physical exertion activities like running, dancing, etc. should be avoided for the next 3 to 7 days after extraction. If the patient has any habits like smoking, tobacco chewing or pan chewing, then these habits have to be stopped for minimum 7 days after extraction. Otherwise, it would delay the healing of the extraction wound. In case sutures are placed at the extraction site, then suture removal appointment would be scheduled in the next 7 to 10 days after extraction, and in case resorbable sutures are placed, then the suture removal appointment is not required since the sutures would resorb by themselves. After the second day of extraction, the patient can start using warm saline mouth rinses after meals. This can be continued until the healing of the extraction socket takes place. This will help to keep the mouth clean and will promote healing. Warm saline mouth rinse can be prepared by adding a teaspoonful of salt to a cup of warm water. This salt water has to be held in the mouth for a minute, swished and then spit out. Please subscribe our channel Dento Friend for more such videos and do hit the bell icon.